Against all odds, family, welcome once again. It's another Sunday, and I just want to say thank you for taking the time out to join us on the show. Today is the last Sunday in October, and as we all know, October is Breast Cancer Awareness Month. And so before the month comes to a close, I thought it would be expedient to get a survivor to come share their story. And today we have Nita Islam, all the way from Bangladesh. Nita is an assistant professor of architecture. Welcome, Nita. She's an assistant professor of architecture, and she is here to walk us through her journey. Welcome, Nita.
Thank you so much, Sylvia, for inviting me to the show.
You are most welcome. You are most welcome. And just to say that later on, we have Dr. David Osafo to walk us through early detection and prevention. So please hold on. Don't go anywhere. We're in for an exciting show. Nita, welcome once again. Do you want to talk to us about growing up and what it was like for you?
Okay. I was born in Moscow, Russia.
Oh, wow.
Because my parents were studying there. And I spent the first 5 years of my life there.
Oh, wow.
And then I came back with my parents to Bangladesh, started schooling, and finished my school, high school, and then joined the university for my undergrad studies in architecture. So after my undergrad, I went to Singapore for my master's. That was the one-year program. Okay. And then again, I went back in 2016 for my PhD.
Oh, wow. Interesting. Thanks for that brief intro. So your mother is a gynecologist. Is that where I'm only asking because in Ghana, we also had a few doctors trained in Russia at the time. But your father is a professor in chemistry, I believe.
Chemistry, yes.
Okay. And your mother a gynecologist. So they both trained in Moscow at the time.
Yes.
From Bangladesh. Interesting. Okay. So your journey with breast cancer started in 2016.
Yes.
Do you want to talk to us about that? When you felt the pain in your breast? Talk to us.
Okay. The first time I felt pain in my breast, which was in my left breast, in the beginning of 2016. So it was January. And I thought that it will be good if I do a mammogram. So I asked my mother. She advised me to do a mammogram. I did it. And the report came out that there is no significant growth, but they did suggested me to go for an ultrasound, which I didn't take seriously at that moment.
Okay.
Yeah. So, then I went to Singapore in July 2016 for my PhD.
Right.
And by then the pain was gone. I mean, the pain which started in January 2016, it was gone within 2 or 3 months. So I totally forgot that chapter.
Mm-hmm.
And I didn't do the ultrasound. And I must mention that I was very lazy in conducting the self-checkup. So I don't think I've ever done a self-checkup. So the next episode of the pain and the lump began in 2017, October.
Okay. So by this time you were in Singapore, you're doing a PhD, and you felt a definite lump. Was the lump painful on this occasion?
No, not at all. This time it was in the right breast, and it was quite big. And because I never did a self-checkup, mm-hmm. I never detected it. Actually, I'm not sure if I should mention it. It was my husband who detected it. It was not me.
Wow.
So then we were alarmed, and we decided that we should do an investigation, a preliminary investigation.
Okay.
But at that time, many things were happening. So, a series of unfortunate events, I can tell you. Okay. So I lost my laptop. I lost all the data of 1 month. It was the end of my semester. So that was a huge pressure on me. On the other hand, my son was studying in a kindergarten in Singapore.
Right.
So he was detected with Asperger's syndrome.
Oh, wow.
So I was kind of, disturbed with that thing.
Okay.
So many things were happening. And also, one of my best friends, she came to Singapore with a fourth stage of cancer. She was detected with breast cancer in 2015.
Oh, wow.
She had a surgery, but
Wow.
then the cancer came back, and it was fourth stage. So she came to Singapore right at that time.
Wow.
So many things were happening in between October and December 2017,
Wow.
which actually delayed my preliminary investigation.
Okay. All right. And at this time, you had a school trip as part of your course. You had to go to Hong Kong, which came with
Yes,
its own set of drama at the time, whilst all of this was
yes.
going on. So, talk to us. What happened there?
Yeah, it was a conference in Hong Kong, and I was very much looking forward to it. But unfortunately, I was refused the visa 2 or 3 times. So I think I got the visa 2 days prior to my flight. So it was a moment when I detected the lump and all this, the other things were happening.
Right.
So finally, I was relieved that, okay, something good is happening to me. So I went to Hong Kong,
Right.
attended the conference. And on the third day, I went out to take the stroll of the city alone.
Hmm.
And I suddenly discovered a very quiet church behind the HSBC Bank. So I went there. There was a choir going on right at that moment. So I sat at the back. I was listening to the choir, and that moment, first time after October, I realized that something grave is coming up, and this lump thing, I need to start thinking about it now.
Hmm.
So I think I was also in a kind of denial mode since October, and all
Right.
these things came up as an excuse to delay the
Right.
preliminary investigation.
Right.
So right at that moment, I was in tears. Yeah. So I cried for a little bit. Yeah. And then I came out of the church. So after coming back from Hong Kong, I went to the NUH University Health Center, and
Okay.
I consulted the doctor. He recommended me to do a mammogram and also an ultrasound.
Okay.
I did that. I brought back the reports to him,
Right.
and he said that based on the ultrasound report, which said that the lump, there is a very big lump and which looks quite suspicious,
Right.
I should conduct a biopsy.
Right.
So um, at that time, we planned a visit to home. So that was planned 2 or 3 months back. So
This was
everything was
back coming back to Bangladesh.
coming back to Bangladesh, yes.
Okay.
So it was a school holiday. So yeah. So so there is again a dilemma. Should I fix a meeting? Should I fix an appointment with the for the biopsy, or should I, you know, go back home and enjoy the vacation?
Right.
So we decided that, okay, let's postpone the biopsy for another few weeks.
Right.
Let's go home because otherwise the whole plan will be cancelled. So I came back home. I enjoyed the vacation. Yeah, it was really nice being here.
Okay.
And I think we went back in January.
Hmm.
After going back, we fixed the the appointment
Right.
with the breast care surgeon, Dr. Philip Lau at
Right.
NUH.
Okay.
And I think the first day we met him was 17 January.
Okay.
So we consulted with him, and After doing a checkup, he immediately sent me to the biopsy room.
Okay.
So the biopsy was done,
Hmm.
and we got the report on 31st January. Yeah.
Wow. Okay. So all this time, when from the time that you come back to the National University Hospital of Singapore,
Mhm.
you said you always kind of intuitively knew, right? What was
Yeah.
coming.
Mm,
So what happened when finally on the 31st of January 2018 when you got the diagnosis?
okay. We went together, my whole family, my son, my husband, me. My son was waiting in outside in the
Okay.
lobby,
Okay.
and we two went in. I sat beside in a chair beside the doctor's table. My husband was sitting behind me,
Right.
and the doctor revealed the report, saying, "I'm sorry to say that it's malignant." And at that point, I realized that um, I was not shattered. I took it very normally because back in my mind, somewhere, I was ready for this kind of result. I
Right.
think it happened because of all those unfortunate events that were happening in 2017, end of 2017, one after another, one after another.
Right.
So I was kind of intuitively prepared, yeah, for this result.
Okay.
So my reaction was, okay, doctor, so what's next?
Wow.
And my doctor's reaction was, okay, I think he is used to of seeing patients, breaking out in tears.
Mm.
So
Mm.
he was also kind of shocked, saying, okay, let's plan the treatment protocol.
Right.
So then we two, the doctor and me, we had a very detailed discussion, uh, the kind I have with my supervisor. So it was very detailed. So he drew lots of diagrams on the papers, and yeah, it was a very scientific discussion.
Okay.
So yeah, so we decided that we will start the treatment from 15 February,
Okay.
and he will do a genetic test. He wanted to do a genetic test for me because according to doctor, my age was abnormal for having breast cancer because
How
I was
old were
37.
you? Okay.
I was 37 at that time.
Okay. Okay.
And to my knowledge, there's no family history of breast cancer.
Okay. Sorry,
So
just
he
to go
was,
back. So when he says the age is abnormal, it means you're too young. You're
I'm
usually
too
too
young.
young. Okay.
Yes.
Okay.
Yes, because in Singapore, they usually recommend a woman above 40 to do mammogram.
Okay. Yeah.
Yeah. So he suggested to do a genetic test, and depending on the report of the genetic test, they will decide whether they will do you know, double mastectomy or a single mastectomy.
Wow.
Yeah.
Wow.
So yeah. So after that, after all this discussion,
Mm.
I stood up and then I looked back and saw my husband's face. So my husband is a very cool and composed person,
Mm.
usually.
Mm.
Uh, but I could immediately feel that he was shattered. He
Wow.
was inside, he was shattered.
Wow.
So yeah, so then we went out. We reached the lobby, uh, reached my son, and then I decided that okay, let's go to a shopping mall instead of going to home, because I knew that if I go home now, you know, yeah, this isolation of home will make us weaker. So I decided that okay, let's go to a shopping mall. Let's absorb the news among the hustle and bustles of a public place. And we went there. We had our dinner. We did some shopping. Yeah,
So you have just been diagnosed with breast cancer.
yeah,
And you are strong. You look at your husband, he is shattered, and you're saying, okay, we're not going to wallow. Let's just go and
Yeah.
be normal people and go do some shopping and have
Yeah.
some food to eat.
Yep.
Wow. 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 Nita, your strength is amazing. So, okay. So obviously you can't stay in the mall the whole day. So
No.
you do all that and you go home. What happens?
Okay. When we were sitting in the mall, I think in Toast Box, the top floor Toast Box in Vivo City, and my aunt called my husband. So my husband conveyed the news to her and requested her to convey the news to my parents.
Wow.
And I think she did that. And I also informed one of my uncle and aunt, I mean, my maternal uncle and aunt. So what they did, they immediately went to my parents' house that night.
Wow.
So there were some immediate support that were there for my parents to help them absorb the news or to tackle with the situation. And then we came back home at night, and I decided to send a long message to my dad. So the message in gist was that I'm sure you have heard the news by now and you must be shattered. I'm your only child, so I can understand how you're feeling. But the thing is that I want to give you some time to absorb the news, to compose yourself, because I want you to be my strength, not my weakness.
Wow.
So take as much time as you need. But the next time I will call you, I will do the video chat. I want to see you to, normal, not crying,
Wow.
not panicked, not
Wow.
anxious.
Wow.
So
Wow.
I'm not sure whether it helped them or they just took some time to hide their feelings, because till now my mother cannot stand the picture that you have put on the flyer. Till now she cannot take that photo.
Wow.
My face without hair and all that. Yeah,
Wow.
so that's what I did, and I think my husband informed my mother-in-law. That was also very difficult for him.
Wow.
Yeah.
Now, Nita, you have been diagnosed with breast cancer,
Mm.
but you are the one calling a rally for strength. You are like, okay, all of you people, we cannot have a funeral right now. I need you all to be strong because it is
Yes.
what it is and we need to fight this. It's basically what you did.
Yes,
Where
because
where did you find that strength in the midst of what someone will describe as a, you it is harrowing news. It is tough news.
yeah, it is a tough news, but well, I really don't have any answer to this question, because I think what this event taught me is that you don't know how strong you are as long as you're not, you know, pushed further. If you know
Right,
you're
right,
not pushed hard. Yeah.
right, right. Until you're met with the circumstance, basically.
Yes. Yes. So I got to know a new self of mine, which I was very much unaware of. Yeah.
Wow. It looks like it was always there. It didn't take long to come
Maybe.
out. It
Yeah.
didn't take long to come out. Okay. So coming back to your story, what treatment were you prescribed?
Okay. So, as I said, that the doctor suggested us to do a genetic test. So, the genetic test took 1.5 months for the report,
Oh,
because they sent the sample to a lab in USA. So it
okay.
took 1.5 months for the result to come. So my doctor said that, okay, let's not wait for the report to come. Let's not wait till then. Let's start the treatment from 15 February. So he, along with the oncologist, suggested 4 doses of AC, which is a type of chemo,
Okay.
and um, yeah, each with a 3 weeks interval. So there were four. So
Okay.
that was
About 12 weeks in total, or?
yes, 12 weeks in total.
Wow.
So first week, then 3 weeks gap, then the second dose. Yeah.
Wow.
So those 4 weeks were, well, sorry, those 12 weeks were really hard for me, I'd say.
Okay.
And after those 4 doses, we got the genetic test report. And fortunately, the result was a negative. So it was not due to any genetic mutation.
Okay.
And that came as a big relief for me because I think that 2 times I cried. The first time was when I came to know that the genetic test, if the genetic test comes out that I'm mutated, my genes are mutated, it will mean that my son will have the equal possibility of developing cancer in his adult stage.
Wow.
So, um, so that was a shock for me. So I remember that day I was crying in the shower. And the second day I cried was probably after my first chemo. I was not being able to sleep for the whole night. And I was thinking, okay, is it going to be the rest of my life will be like this? So I cried for 5 or 10 minutes. So yeah, that's it. So yeah, the genetic test came out negative.
That's
And
good.
by then I was done with my 4 chemos. So we went to the doctor and we discussed in detail about different options of surgery. So the options were lumpectomy, which is to scoop out the lump only, with or without breast reconstruction. And the third option was mastectomy, single mastectomy. So after
Which
many
was
thoughts,
basically to cut
to
the
cut
whole.
off the breast, the
Whole
whole
breast.
breast, yes, whole
Okay.
breast. So after he gave us some time to think about different options and then give our decision. So I decided to do the mastectomy.
Okay.
So then the surgery was done in 20th June 2018. Yes.
Right. Okay. Nita, did they ever, so this is in terms of treatment, this is the closest I've come to discussing anything like this. Is there a reason why they do treatment before they do the surgery? Is there a reason why they have to do the chemo before they do the surgery? I'd imagine that if you're going to do a mastectomy, maybe just take it off and everything goes. Is there a reason why they have to do that?
Yes, there is a reason. As far as I know, Dr. Osafo will be able to elaborate more. There are 2 methods. In the first method, they call it a sandwich method. So chemo, surgery, and then chemo. And in the second method, they usually do the surgery first, and then they prescribe the chemos for prevention, further prevention.
Oh, wow.
So in my case, I think the reason was because we had to wait for 1.5 months for the genetic test to come out.
Okay.
So, yeah, I think the chemo was aimed to reduce the size of the lump as much as possible
Okay.
before the surgery, because the surgery decision can be a lumpectomy. So if it's a lumpectomy, if the lump size grows, smaller, then it's easier, right? So I think that was the reason. But of course, in some cases, they do the surgery first. In my case, it was a sandwich method.
Okay. Wow. All right. So you had the surgery in June.
Yes.
You get diagnosed in January. By June, you have finished your chemo. How long did it take for you to recover from the surgery? Surgery. And did you need any more treatment after surgery?
Yes. After the surgery, I had to take another course of chemotherapy, which was Tadsol this time, and it was a weekly dose. So I had 1 dose each week for 12 consecutive weeks. So it was 12 doses of Tadsol.
Wow.
And I think I started taking Tadsol 1.5 months after the surgery, because they want the surgery wound to heal properly before they give the chemo. They start the
Wow.
chemo.
Wow. What was the
And
toll of, sorry, carry on.
yeah, please carry on.
I was going to ask what the toll of all the treatment on your body was, but maybe you can combine it with what you were going to say.
Okay, maybe I'll tell you the treatment, and then I'll tell you the what
Yes,
it,
please. Yes,
what
please.
kind of
Yeah,
effect it had.
sorry I interrupted
So
you there.
no, it's fine. So after the 12 doses of Taxol, I was suggested to take 25 sessions of radiotherapy, because first, I think my surgeon said that you may or may not have to take radiotherapy. But during the surgery, they discovered that I have one lymph node affected. It was a microcalcification, but they didn't want to take a chance. So they suggested to go through the radiotherapy. So it was 25 sessions of radiotherapy. And after the radiotherapy was done, I was prescribed endocrine therapy, which I'm still undergoing. It's a tablet that I have to take each day, and I have to take it for 10 years.
Oh,
So,
wow.
so that's the kind of summary of the overall treatment. And regarding your question about its toll on my health and everything, the first 4 chemos, that was fifth semester of my PhD.
Were you
So
still studying during the treatment?
yes, I didn't take any break. I
Wow.
mean, I didn't apply for any official leave.
Okay.
And I was also engaged in a TA, teaching assistantship with my supervisor. So
Wow.
I had to attend one class each week. So it was 9 classes altogether. But I was not being able to join all the classes. I think I joined only 6. Yeah.
Wow.
But my supervisor was extremely kind to allow me to claim all the hours. I mean,
Wow.
all 9 classes. So I'm extremely grateful to him for that. So yeah, I didn't take a leave, but those 12 weeks of chemo, first 4 chemos, were really hard. Yes. I used to feel weak, extremely weak, um, fatigued. Yeah. A strong person like me, I sometimes I couldn't even walk for, like 10 or 20 feet,
Oh, wow.
yeah, at a stretch. So it was
Wow.
very tiring. It was very, yeah. And all my hairs were gone. But I was least bothered about that. The only thing that bothered me was after the first chemo, I lost my appetite. So there was no taste on my taste bud. That was the thing that shattered me, because I'm a foodie. I love to eat. I love to cook. And I was like, I read in some of the articles that some cancer patients, they never get back their appetite. And for me, it will be a curse. It's a bigger curse than, being bald. I
Right.
can live with being bald, but I cannot live without my
Your
taste, my
food.
appetite. Yes. So thankfully, after the second chemo, I got back my taste, my appetite, and I started cooking. I started eating. Yeah. So yeah. So that was the first 4 chemos. The next round of chemos, which was weekly chemo, I think it was low dose, and it suited me better. So I remember I used to take rest for 2 days, the first 2 days of the week. And then the rest of the 3 days, I used to go to the department and work. And that was my sixth semester. So I completed my qualifying exam report. I I worked for 152 hours as teaching assistant.
Wow.
Yeah, so I could do all that along with those 12 doses of chemo and 25 sessions of radiotherapy. Yeah.
Wow. Wow. You are an incredible woman, Nita. You are, your strength is just incredible. So have you have to take this tablet for 10 years. Does this mean that you're not given the all clear until then, or you have been given the all clear now?
My surgeon has given me an all clear during our last consultation session. So he said that I think you don't need to see me again. And I'm very happy about that you don't have to see me again. So yeah, but I do have a regular checkup with my oncologist. So I'm still going through the follow-up checkups with my oncologist.
Wow. And how often are those?
Usually it's at an interval of 4 months, but due to this pandemic, I couldn't attend the last follow-up checkup, which was due in March. We had to cancel that. Yeah.
Okay, that's amazing. And how about your husband? Did he recover from his shock? And how involved was your son in all of this? Did you tell him about,
Okay. Yes. My son was, at that time, he was 7 years old. And he was informed about this whole thing.
Wow.
Not in very detail, but he knew that his mother has cancer. And he was actually, there was no use of hiding from him because he was seeing me so close, seeing the changes in me. He was seeing me in pain and he was seeing me fatigued. So we decided that, okay, let's explain to him everything as normally as possible. Okay, this is a disease. This happened to mom. Mom is going through treatment and mom will be fine. So I think that helped, and he took it very normally. Although that day he was telling me that I was very sad when you had to shave off your head. Yeah, wow. He just mentioned it a few days back to me.
Oh, wow.
And he's very happy that my hair is growing back. So that was my son. And another thing, we ensured that we didn't let his daily routine getting hampered because of my treatment. So he was going to school, he was going to the Gilmore Park for playing in the evening. His dad used to take him there. Okay. So his daily routine was as normal as before. And about my husband, he got back. I mean, he recovered from the shock. I would say very quickly, and
he didn't have a choice, did he?
I know. He's like, and as I told you, he's a very composed person, and he's a very calm person compared to me. And I must mention this, that the way he handled me and he handled our entire family and this entire time during the treatment was amazing. Wow. I mean, I still remember he used to do all the household chores in the morning, taking son to school, cooking food, cleaning, washing, and then he used to go to gym. So he was also very cautious about his health. Mm-hmm. And then because he's an architect himself, so he used to conduct all his consultation over the online platforms. Wow. So communicating with the people here in Bangladesh. So I often asked him, how do you manage all these things? If I was in your place, I could have never do all these things.
We're not sure about that, Nita, after everything you've told us.
Well, yeah, I don't know how I will perform. Yeah.
You would have been like, okay, come on, life goes on. Come on, let's go.
Yeah.
Nita, you have been incredible. We're not letting you go yet, but this is the time when we're going to let Dr. Osafo come in, and maybe we'll let him first comment about your case, and then he can go into it and tell us what he has to tell us. So, Dr. Osafo, welcome.
Well, thank you, Sylvia. Good to see you again. Nita,
Yeah.
I just met you, and I must say you have an incredible story, and I applaud and commend you for your strength that you showed during your journey.
Thank you so much, Dr. Osafo. Thank you.
And Sylvia had asked a couple of questions about your treatment, which I can expound on a little bit. Mm. The reason you had those first 4 chemotherapy treatments prior to surgery was so that the cancer would have a chance to shrink to be able to
Yes.
afford you the opportunity for a lumpectomy if you wanted one, and also not to wait until the genetic test came in before starting
Yes.
all of the treatment. So you had something going before the result came through.
Yeah.
And that's quite commonly done all
Right.
over the world. So you did have the sandwich treatment. 4 cycles of AC, the two drugs are adriamycin and cyclophosphamide, followed by 12 cycles of Taxol once a week as standard of care. And there are a few times when you may not need radiation after a mastectomy. You did have to go through radiation because of lymph node involvement, and that's all appropriate. So you did not get anything that's unusual. You got everything that you needed.
Yes.
And you're in complete remission right now. That's great. You don't need to see your surgeon anymore. It's always good when you can
Yeah.
communicate with that. Yeah.
Yeah.
Wow, that is awesome. Viewers, Dr. Osafo is, we failed to introduce him properly, but he is an oncologist here in the US, in Louisiana. So, Dr. Osafo, we hear a lot about breast cancer. I mean, understandably, it affects a lot of women. But we also know that it is no stranger to men at all. Do you have any data on comparison as to how many percentage of men, for example, versus women?
Roughly, the percentage of women versus men who develop breast cancer is 100 to 1.
Oh, wow.
For every 100 women who will develop breast cancer, there's one man out there who will do the same.
Wow.
And Nita had made reference to genetic testing in regards to her son. If she had tested positive for the deleterious gene, the BRCA gene, commonly referred to as a BRCA gene, then there would be a higher chance of her son developing breast cancer or indeed other cancers, even like prostate cancer. The
Wow.
BRCA gene mutation does confer that development of cancer in males, in
Right.
families with the gene mutation. When it comes to women, the lifetime incidence of a woman developing breast cancer is 1 in 8. It's higher after the ages of 50 and 60. And actually, the most common, the median age of development of breast cancer is in your early 60s. 61
Oh, wow.
is what it is.
Wow. Wow. And do we know what causes breast cancer? Is there anything that we can say, perhaps if we avoid this or that, or not do this and that we could maybe perhaps avoid breast cancer?
Generally, with cancers, there are modifiable risk factors and unmodifiable risk factors. So, the unmodifiable risk factors are things like female gender. You can't change that.
Right.
Family history, age. Just by drawing breath and growing older, you're more likely to develop breast cancer.
Right.
With the modifiable risk factors when it comes to breast cancer, the only one that's talked about mostly is alcohol intake, and the correlation is actually not too strong. But whatever the recommended daily allowance of alcohol is what you should stick to. And for a long time, it's been 2 drinks or so per week for a woman.
Okay.
So that's if you would stick to that, you're most likely going to be in the clear regarding alcohol as a risk factor for the development of breast cancer.
Right. Are there other lifestyle choices
You
that
would encourage exercise
okay.
and moderate exercise of 30 minutes or so 3 times a week is adequate. So
Okay.
avoidance of alcohol or reduction of alcohol intake and promotion of exercise 30 minutes 3 times a week is strongly encouraged.
Okay. And how crucial is early detection in terms of saving lives?
That's about the most important thing anyone can do for them. Because with early detection, you hopefully find cancers in early stages. And as we know statistically, the earlier the stage at diagnosis, the higher the cure rates are. So early detection follows through to higher cure rates.
Okay. So basically, in terms of lifestyle, we watch our alcohol, moderate exercise, and I can imagine eating healthy.
Eating healthy.
And what can we do in terms of early detection? We've spoken of mammograms and things like that. What are the steps to do, and what are the recommended ages to
So
do
you
those?
follow national guidelines. Nita had said that in Singapore, from the age of 40, yearly mammograms are recommended. Different task forces have different recommendations. Generally, 40 or 50, you need a mammogram once or twice a year. So you follow the guidelines of the country that you live in and make sure that you stick to those.
Okay.
And anytime there's a mammographic abnormality in a patient, it will be followed by a request for another test, an ultrasound, or a more detailed mammogram,
Okay.
which will lead to a biopsy. So those are actually quite important as well, the follow-up tests on the initial mammographic abnormalities. You may do them and find out that it's still classified as a benign lesion, and which is great. You'd love to have those results anytime. But just in case it's not benign, it's malignant, then it comes back to what I alluded to a little bit ago, that you find it early so that your chances of cure are higher.
Right, right. And in terms of guidelines, what are the guidelines for the US? If just as a guideline, because a lot of our viewers are from the US. At what age must we do the mammogram
50,
as
you
women?
start doing them once a year.
50, at the age of 50 once a year.
A year.
Okay. All right. Are you able to talk us through a breast examination? Obviously, it is recommended that for women that we check our breasts ourselves, whether it's in the shower or whether we're in bed. Are you able to show us exactly, for the benefit of our viewers, what we are supposed to do in terms of examination?
Right. I actually like to recommend that if you're going to do a breast self exam, do it in both places, both in the shower and in bed. The
Oh,
reason is that in the shower, where there's water and soap on you, it is easier to feel anything with that slippery surface.
oh wow.
And then you should also include your underarms.
Okay.
So if you feel your armpits as well as the bit of tissue between your armpit and your breast in the shower, it's easier to do. And you move in a systematic way. So if you start in the underarm and then feel down to the outer upper part of the breast, then you feel across without taking your fingers off the breast. So you feel across to the center of your chest and then go down a little bit and then feel back across to the outside of your breast and then down and back and forth and across the nipple till you get to the bottom of the whole breast. And you repeat that on the other side.
Right.
Now, the reason why I also recommend that you do it in bed is when you're lying flat, it's easier to feel certain lumps compared to when you're standing in the shower.
Right.
So I like for women to do both.
Right.
And you choose, and also breast self exams, though they are not recommended as part of screening, that's what you do for yourself at home.
Yes.
I recommend that you do it once a month.
Okay. That's what I was going to ask.
You pick a day of the month you want to do it, the first of the month, do it every first of the month, or you pick your birthday date. If your birthday is on the 15th, every 15th you do it, but once a month. You do it in the shower and while you're lying flat in bed.
Okay. Do our periods affect at all what we feel? Because I know in terms of hormonal change, will it affect if a woman is in her period? Will it affect what they
It
feel at a certain
does,
time?
and it's more so the time before and after your menstrual cycle where your breast density changes.
Okay.
So it does affect that, yes.
Okay. Okay. So would you then say that you recommend maybe a week after the menstrual cycle is over to do this
That
self-examination?
that's a great idea, and I've recommended that as well.
Okay. All right, excellent. Do you have anything in terms of pathology that maybe you could show us? I can see you're in your office. Is there something that maybe you could show us, our viewers?
I
Uh,
could. So, looking at the
okay.
model of this, if you were to do a self breast
So,
exam,
Dr. Osafo, if you could just hold on one second, I am going to take Nita and I backstage. Just so this is important. So I just want to have you have a bigger screen so people can see this well, and then maybe as you describe it, you can show you can do this self breast examination. You can show it with this model as well.
we can certainly do that.
Yeah, thank you.
So while I have this up, there's a model of the female breast. To do a self breast exam, you would start on the outside, run your fingers across without taking it off the breast to the middle, down a little, back, down a little, and back and forth until you get to the bottom, across the nipple, until you get to the bottom of the breast. So you make sure that the whole surface of the breast is covered. As oncologists, when we get reports from the pathology department, what we describe to patients is what happens on the inside of the breast. And these are certain lesions that we like to point out to. This is what the pathologist will see, and this is what the surgeon cuts out. So a lumpectomy is when the surgeon removes the lump only with a rim of normal tissue around it, and he'll do a lymph node biopsy as well, right here. A mastectomy is when the whole breast is surgically removed, again with a lymph node biopsy, because that's important in determining the stage of the cancer, as all treatment follows from the stage. The involvement of lymph nodes is the biggest predictor of outcomes. Your prognosis depends on lymph node involvement. So the pathological reports that oncologists get always include lymph node involvement, which is very important for treatment plans.
Wow, 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 wow. That was amazing. Thank you. Thank you so much for that, Dr. Safo. I just had a question. Where are we going in terms of women and breast cancer? Is it becoming more or is it becoming less? I mean, I can imagine in terms of treatment, that so much progress has been made. But in terms of just data and numbers, are we seeing an increase or are we seeing a decrease? Because now there is more knowledge about, like you say, lifestyle and things like that.
The increase in incidence has been in the last 30, 40 years, and that's due to detection, as it has been with other cancers like colon cancer and colonoscopies. The mammography has enlightened us a lot. But breast cancer still remains the second cause of cancer death in women. It's second only to lung cancer.
Oh wow.
So there's still a lot of work to be done.
Hmm.
And as common as it is, with a lifetime incidence of 1 in 8 women, it's very, very common. So strides have been made, cancer cure rates are improving, and the advent of immunotherapy is quite exciting in the world of oncology these days, hoping to incorporate that into different types of malignancies to help
Well,
drive cure rates higher.
amazing. This has been so good. This has been so educational. Do you have anything else you want to share with our viewers, Dr. Osafo? Is there any last word you want to leave with our viewers?
I can't overemphasize early detection and adhering to your schedule for mammograms as the years go by. I preach that in my practice. I'll continue to do that at any opportunity that I'm given. It's the most important thing that anyone can do for
Right.
themselves.
Right. So, viewers, you heard the doctor. I know we're tuning in from all over the world, so please find out what the recommendation is in whatever country that you live in. In the US here, it's starting mammograms at the age of 50. In Singapore, it's 40, as we have learned. So please find out from whichever country you live, what the recommendation is, and go and have yourselves checked. Nita, what is your message to our viewers? First of all, Nita, for you, if there is anyone going through what you have gone through,
Yeah.
what would you like to say to them right now?
Mm, I have two messages for them. The first message is that cancer doesn't make you more mortal. So you are as mortal as you were before you were detected with cancer. So just because you're diagnosed with cancer, uh, don't start thinking that you're done, you're doomed. You know, you're more mortal than any other around you. Yeah. So that's one thing you need to know. And the second thing is that yes, the treatment is going to take a huge toll on your health and on your look, of course, which is very important for us women. I just want to say that you know, you can live without your hair, your eyebrows, your eyelashes, but as long as you're breathing, you have your taste, you can taste food, you can sleep. That's all you need. So just don't bother about your hair and yeah, all those silly things. Yeah, you can draw the eyebrow, you can put a false eyelash, you can wear a wig, you can do many things.
Always ways round it. Always ways
Yes,
round it. Always ways
yes.
round it. Dr. Osafo, how important is it? I thought I was done with you, but and there's always a question coming up. How important is our attitude, like Nita had, or like she's describing, when for
Optimism,
someone at home who has been diagnosed?
optimism and positivity is very important. The patient's outlook psychologically plays a very big part in their journey through the diagnosis and treatment. Because as you heard, the treatment can be quite difficult, physically challenging for the patient to go through. And if you have, and of course, the emotional support of the family cannot be underestimated ever. But personally, if you have such a strong personality, like and you're able to go through the treatment like Nita did, it goes a very long way to helping you.
Awesome.
Yeah.
Nita, what are your final words for our viewers?
Well, I'd like to echo what Dr. Osafo said. Please don't ignore self checkup. I have ignored it and I have suffered. So that's one thing that I would like to stress again and again. And yeah, you can skip that, appointment at the salon. Yeah, the amount of time I spend at salon for my long hairs, you know, I didn't spend 1/10 of that time for self check. Yeah, so that's a message for my viewers. Yeah, and also, um, yeah, and get educated. Yes, sometimes even when we are educated, we are kind of ignorant about many issues. So if you're detected with a lump, if you see any symptoms, try to educate yourself. Yeah, because in many countries we don't get proper guidance as we get in Singapore or in UK or in USA. There is established system of treatment, and established medical teams. But in countries like Bangladesh, it's not there. So, yeah, so try to educate yourself as well. Try to know your reports, try to read them, try to know what's happening to you, why this treatment is given to you, for what reason. So, yeah, in this age of information, it's possible.
Awesome, awesome, awesome. Great words. Dr. Osafo, I just want to say thank you for taking time out of your busy schedule to join us. Nita, thank you so much. Guys, the time difference between here and the US and Bangladesh is crazy. It is, I think, almost midnight there right now, right?
It's 10:15.
And yeah. And basically, she said, yes, I do need to tell my story to help the next person. So thank you both so much for appearing on Against All Odds. And
Thank you so
viewers,
much for having us.
thank you, thank you, thank
Thank you
you,
so
thank
much, Sylvia.
Thank you. Thank you. And viewers, if you have caught this live, please share. You never know who it will help. Let's share with your neighbors, share with your friends, share amongst your network, because together we can beat breast cancer. Thank you, viewers, for watching. Subscribe on YouTube, follow us on Facebook, and on you know where to find us. It's gone out of my head, but thank you all so much.